LGBTQ plus health and the pandemic. Since February of 2020, this segment has been unique in answering your LGBTQ plus community questions about our unique health needs. We are proud to have Queer News Tonight's health anchor, Dr. Howard Grossman.
He is an American pioneer in HIV/AIDS medical treatment and was the executive director of the American Academy of HIV Medicine. He is a nationally recognized medical expert and proud member of our LGBTQ plus community.
Well, good evening, Dr. Grossman. And before we move into some of the questions we have for you tonight, we want to look back over the last week and ask you about some of the thoughts of what you've seen in the health news for our community.
Well, if I could just make a gentle correction now to what you were talking about a little while ago. You know, we talk about the fact detectable equals untransmittable. And it's not 99.9%. There has never been a case of somebody undetectable infecting somebody. So we all need to stop being equivocal about this and say it is not going to happen. It has never happened. And people who are undetectable, I think that's part of the whole You Equally You movement, is to stop us from these equivocations that maybe there's still a little, possibility, because it's never. And so there's a reason why people need to be adherent to their medications and why we strive to help all of our patients get to that undetectable place. Liberating. We're positive.
I appreciate the observation. We're right there with you on it. I participated with you in the Florida LGBTQ plus Democratic Caucus on Saturday. You hosted an HIV and AIDS. There's been slightly little news this week that has caught everybody's attention during the pandemic, and it doesn't have anything to do with vaccines or drugs or hospitalizations. It has to do with a person named Governor. What do you make of what we have watched in this last week?
Well, Ron DeSantis and Greg Abbott from Texas, I think they're peas in a pod. We're watching some Republicans like Asa Hutchinson, who is walking back the fact, saying that, forbidding mask mandates. And we see the governor of Alabama as well. Some of these things and saying she was wrong to say some of the things she said. But we have people like DeSantis and Abbott digging. I love the fact that DeSantis is blaming the border, some kind of border crisis for the explosion. And there's no border next to Florida. Right.
Howard, I did a post today in social media talking specifically about the need for vaccines and how political, and I basically said, well, you can withhold all of the money you want and all of the salaries you want, and we can withhold your seat in 2022. And somebody came in and posted, well, why don't you pay attention to the hundreds of thousands of people that are illegally crossing the border that are bringing COVID in, and that's really what's causing the COVID pandemic in America. How do you even deal with that medical misinformation?
Well, I mean, it's just stupidity. There is no way to deal with these trolls who want to repeat these memes that make no sense at all. And I think they just need to be shamed and pushed away. You can't. There's no rational way to deal with this stuff.
Mm-hmm. All right. Well, let's jump into some of the questions we have.
First of all, good to see you again, Dr. Grossman. Last time I saw you were having dinner with us.
I will. Best restaurant.
Thank you. More people have now died in Florida than DeSantis won the election by. Do you think there will be political change because of the pandemic?
It's really hard to say. I mean, certainly if they kill off enough of his supporters, that's gonna make a difference. But let's face it, the hospitals are full. People are dying. Memorial Hospital, has people in the cafeteria. I mean, all the hospitals in Florida are full. In Texas, in Alabama, in Arkansas. in all the states with governors who have failed to take proper precaution. And hospitalizations are up all over the place, but not like in the South.
Yeah, thank you.
And will that have political repercussions? I don't know. I mean, Trump got elected despite every, horrible thing that came out about him. So some of these people seem immune. You have Rand Paul out there putting out videos this week about how children don't get COVID, and it's like a mild flu for them. But meanwhile, kids are being hospitalized and dying and getting infected record numbers.
It was encouraging to see this week that several local schools have actually overruling what the governor has put into place and are forcing or adhering to masks in schools for young kids. Because I was actually approached yesterday by an LGBT parent whose kid is going back to school at the age of 6 and was in somewhat of a panic because they didn't know how to handle it. And then right after that, we found out that the court had ruled that DeSantis could not stop them from wearing masks. So.
Right. And the Dallas school board came out yesterday and said that they were going to require masks. And that's a huge school system, and I think he's not going to be far behind.
Yeah. Excellent. So let's go to our next question. The Lambda variant has now been seen in the U.S. How much should we worry? Is it targeted to LGBT people, this Lambda variant? Sorry, I couldn't resist. I couldn't resist that joke.
That's good. I like that. No, Lambda variant is actually showed up in Peru about a year ago, and now has become the dominant variant in South America. Started showing up in the U.S. Recently, and now has been reported, I think, in 44 states. It's felt that it might be more infectious. They haven't really compared it to Delta, but it's has that same increased infectivity. The question is how the vaccines will work. It seems that it's been tested against it seems that it's less effective against the Chinese vaccine, the CoronaVax that China is providing mostly to South America. But that's a vaccine that's in the same class as, say, the Johnson & Johnson vaccine and the AstraZeneca vaccine. It's a killed virus vaccine. It's different from the Pfizer and Moderna vaccines. And there was some evidence from NYU this week, I think, that those vaccines are still effective against the Lambda variant. So, the question is still there, where it's just being investigated, and we'll see. But clearly it sounds like it's more infectious than stuff that came before.
Thank you.
So, Dr. Grossman, forecasts indicate the new COVID surge in Florida may not peak until September. Do you think Pride celebrations for this year should be postponed?
That's, it's a good question. I think that, when we talk about, for example, what happened in Provincetown over July 4th and Circuit Week, we have to remember that, number one, there were probably 60,000 people in Provincetown, and the total number of people infected was about 480. And that, about 74% of those people had already been vaccinated. But you were talking about people being crowded into small venues, closed in, sweating, dancing, people felt safe, and so they went back to old activities. Those are sort of, super spreader, it's an incubator for infection. It'd be interesting to see what comes out of Market Week in Chicago, which just ended recently. Another place where people were, packed in, sweating, dancing. I think those kind of venues probably are not a good idea right now. I think, a gay pride celebration where there's a parade and, perhaps people are outdoors and maybe not packed into places, that might be a safer thing. For example, I'm not too worried about going to the supermarket. I know people are wearing masks again in the market. But the market, how many people are in the market at one time? Packed in, it's a big open space. You think a vaccinated person is probably more safe in that kind of environment. People need to do what they feel to protect themselves, but I think with the vaccine, we're pretty safe in those kind of spaces.
All right. Well, that is tonight's Q&A on LGBTQ plus health and the pandemic. We're here every Tuesday with Dr. Howard Grossman to answer your questions. Do you need medical assistance? Now, we're LGBT. Of course we do. We encourage you to contact Dr. Howard Grossman here in Wilton Manors and serving all across South Florida. Thank you.